Have you heard a lot of rumors about Medicare Advantage plans restricting where you can go to the doctor or to the hospital? There's some truth into it, but it's wildly overblown and over-exaggerated. And in this video, I want to dispel some of those myths and also explain to you what aspects of this are true. Let's get into it. Hi folks, Christian Brindle here, Medicare health plan expert and specialist. Today we're going to be talking to you about Medicare Advantage plan networks and what it is that you need to know about them. So there's this narrative, I would say, that often gets put out there in the forefront about Medicare Advantage plans that you can't go see your doctors. There's some truth to this and there's also some not truths to this. So first things first, we have to understand what a Medicare Advantage plan actually is. So Medicare Advantage plans are programs that essentially are what's known as managed care plans in a lot of circles. Managed care plans or Medicare Advantage plans are programs that essentially take over the responsibility of your claims for Medicare. They essentially issue your coverage through a private insurance company, and that private insurance company takes over the responsibility of your medical claims. They also will typically add Part D prescription drug coverage if you pick a plan that carries that. A lot of plans will also give you additional benefits that Medicare does not carry, such as dental, vision, hearing, and so on. This is important because Medicare on its own is typically only medical coverage and only 80% medical coverage at that. What a lot of people don't understand with Medicare Advantage plans is they are specifically built for one particular area. The Medicare Advantage plan is going to be a plan that is specifically built for an area. It's going to have a service area, if you will, and that could be a particular state. It could be particular counties within a particular state, but that's going to be the service area to where you can get in-network coverage. Medicare Advantage plans have HMO and PPO networks, respectively, for most situations, to where an HMO is going to allow you in-network access, but very limited outside of network access, whereas a PPO gives you an in-network capability, but it also gives you out-of-network capabilities at a higher cost. But typically, it's better for you in a PPO to go in-network because the costs are typically that much greater going out of network than they would be staying inside of your network. So what's the truth? The truth is that every single Medicare Advantage plan is going to be different. Certain Medicare Advantage plans are going to have larger networks and larger capabilities of going to different hospitals and doctors, more choices, and other plans are going to have much smaller options in terms of where you can go to the doctor and the hospital. It just depends on the plan, folks. It's no different than any other types of health insurance that you've had throughout your life. Some plans have great big networks with lots of choices. Some plans have itsy bitsy tiny networks. Pick a plan that is going to cover your respective doctors and hospitals. Make sure that all of your providers are in the network. Make sure you understand where you can go. Make sure you understand what your plan will do outside of the network, outside of the service area. See if it has a travel benefit capability built into it, because a lot of plans do nowadays. Most Advantage plans are going to cover you outside of network for an emergency room anywhere in the world as if you're in network, and a lot of plans will cover an Instacare or an urgent care center outside of network as well as if you're in network. And a lot of plans also will cover you for emergency ambulance benefits outside of your network as if you're in network. It kind of just depends on the plan, but the network is only a problem if you just make a snap decision, sign up for a plan without checking your doctors, without checking your providers, and without understanding your network. I feel like as long as you take the steps to avoid these challenges, you are typically going to be A-okay when it comes to Medicare Advantage and making sure your providers are in your network. Anyway, everybody, thanks so much for watching this video. If you enjoyed it, do us a favor, hit the like button, hit the subscribe button so you're subscribed to our channel, hit the notification bell so you're notified when we upload, drop a comment on any Medicare Advantage plan questions that you feel we should answer that might have not had time to be touched on this video, and we might just make a video about it going forward. Thanks so much for watching. Have a great day.